And one of the other major problems I find, particularly in trichology, amongst other professions, is the worry that clients coming to you online are not going to be suitable or qualified for the services that you provide. So in other words, what you provide is not what they really need, or they should be going to one practitioner but not another, or even that they've got coronavirus positive in the past few days and shouldn't really be attending anywhere. There are lots of things you can have concerns about, and Medesk aims to help you address those. So what we try and do is build up the booking system so that when the clients are booking, they can actually answer questions that will then enable you to see whether they are suitable. So it can be pre-appointment questionnaires, so it can be about their condition, duration, onset, all these sort of things you'd normally ask as part of a history in a case. And you can then get an idea of, first of all, what's going on. Secondly, who among your colleagues is most suitable to deal with that particular condition if it's not you. And thirdly, you can then decide whether it warrants telemedical consultation first as an extra screening method and maybe a full solution, or whether actually they should be coming in person. So you can screen at that point for these things. And one of the biggest things we've introduced over the past months, of course, is the ability to screen for COVID symptoms. So we actually do have a questionnaire. This is not the whole questionnaire, of course, it's just a screenshot of a few parts of it. And essentially what you're doing is making sure that a person doesn't have any COVID-associated symptoms, make sure that they are, for all intents and purposes, going to be negative for any coronavirus in the body. And from there, you can make sure that they are okay to come in person. Because you're going to follow all the various guidelines and hygiene practices and so on, but you don't want someone coming in being coronavirus positive, or if there's any risk of that at all, it's just better to be safe than sorry. And so we make that pretty easy for you to do. And one of the things that you can do as well is actually you can, as part of the automated confirmations and reminders that I'm going to talk about a bit later, you can actually put the coronavirus questionnaire as part of that reminder. So you can put a reminder, say a day before the appointment, and just say something like, Dear John, just a kind reminder that your appointment is tomorrow at this time and date. Please note, if you have any of the following symptoms, do not attend and let us know to reschedule in 2 weeks' time. Something like that. And then what you'll do is weed out any of those last minute problems where people have, suddenly got, lost a sense of smell, or got any other symptoms that might be confused for COVID symptoms. And of course, you can pre-match things in advance. So if there are certain conditions that only individual people can treat in your practice and not everyone can, you can pre-match them in advance and then let the patient or client choose who that is. And you can make that particular attachment of practitioner to condition visible or invisible to the client. In this case, it would be visible, so they could choose, but you can also make it automatic and it will go to whoever's available at that time, and first come, first serve kind of situation. Just depends on what you think is most appropriate and what really works for your clients as well. We release new videos every week. Hit that subscribe button to learn how to grow your practice faster.